Namaste everyone, welcome back to my channel, that is Dr. Meenakshi's Medica. Myself Dr. Meenakshi, MD Kamara Bhritya. So as the topic is examination of newborn, when we say examination of a maybe newborn or adult, when we say the examination, we will directly go for physical examination and systemic examinations, right? And according to the complaints, we will do the separate parts of examination. But what is this exactly the examination of a body from head to toe? No one knows this, right? As in OPDs, as we are consultants, when they come with the complaints, directly we do the examination of particular part which they are complaining, and we will give the treatment. But the basic step, that is what is the examination of whole body from head to toe, maybe in healthy baby or maybe in diseased. In diseased we will go through the systemic, according to complaints we will go. But for healthy baby, what all the examinations we should do from head to toe, we will see today. So today's our topic is examination of a healthy baby from head to toe. What all examinations we should do, right? Because though in diagnosis we should know the exact way of examination, basically we should know what is the normalcy of this examination, right? What is the normal point of examinations of the part? If we know normalcy, then we can identify clearly the abnormalities. So we will see healthy examination of a newborn. So from head to toe, crown heel length, that is from head till toe, what all parts of examination we will see. First of all, when we come for examination, what all we should examine? Vital signs, temperature, baby's weight, baby's crown heel length. These all are the basic indicators. Then coming for the normal activities of a baby, that is basic points which we should observe in a baby, that is the activity of a baby, maybe the movement of extremities, the sleep and awaken time of a baby, whether baby is irritative or non-irritative, and whether baby is consolable or inconsolable. These are the basic observation points we can see in a babies, right? So then coming for the head to toe examination of a part, first of all, from where we should begin? From head. In head, what all we will examine? The head circumference, that is the measurement of a head, which we will do from the above of the eyebrow. We should circle a measuring tape and we can take the head circumference. These will give the exact measurement of a head of a newborn. Because why we should do this? The head circumference will be larger than chest circumference in a newborn. So we should do this. Then next point, what we should see in head, that is shape of a head, whether it is microcephaly and macrocephaly, because these we want in some syndromes or disorders. Then what we should see in a head, the anterior fontanella and posterior fontanella, because these are the suturing points. The sutures didn't closed here still, so this anterior fontanella and posterior fontanella will find, and this anterior fontanella will close at the age of 2 years and posterior fontanella is at the age of 9 months. Then next point, what we should see in head is, that is the cephalic hematoma, caput succedaneum and subgaleal hemorrhage. These are the basic complications of a head at the time of birth, and about the explanation of these we will go through the next video. Next, coming for the face. After head, what we will examine? Face. What all you will examine in a face? First is ears. How our ears should be? The upper part of a ear should be equivalent to the eyes. When you line a horizontal line, it should be equal to the eyes of a newborn. And next, coming for the formation, shape of a ear, that is ear cartilage. When you press the ear cartilage should recoil within a seconds. You can see this in a newborns. Next, coming for eyes, what all examination you will see in eyes? It should be wide spaced specially. Then the eyeballs movement, whether they are horizontal or they are concave, or the movements of the eyes, because in some syndromes we will see squint eyes, right? So we should see. And the examination of eyes through which you will do with the ophthalmoscope. We will raise the ophthalmoscope to the eyes of a newborn, and you will see the inner part, that is functioning maybe, or reflection maybe, everything, pupils, dilatation, everything you can see through the ophthalmoscope. Next, coming for the nose, what all examinations you will do in nose? First of all, shape of the nose and breathing pattern, because if any blockage, then you can have the irregular breathing or pause breathing, everything. You can see the breathing pattern. Then especially this pause breathing or irregular breathing is known as pediatric breathing. They will be having this type of pattern breathing, but you should see for any obstructions, because immediately after birth we will do suctioning, right? Through suctioning, maybe in some point of situation, the baby may have injuries through airway. So you should investigate the airway. Next, coming for mouth, what all you can examine? First of all, cleft lip. If baby is having cleft lip, we can see through visualization. But if baby is having cleft palate, you can keep your hygienic finger in a baby's mouth, or you can use a sterile gloves and you can keep the finger in a baby's mouth. Through sucking, we can examine the hard palate and soft palate for cleft palate, and the sucking reflex we will get to know. And another thing is tongue. Some babies will have tongue tie. They will be having difficulty in feeding if they have tongue tie. You can examine these 3 points in a mouth. Next, coming for after face, neck. What you can examine in the neck? In some sort of syndromes or disorders, some babies will be having neck webbing or extra growth, muscle growth in a neck, that you can examine in a neck part. Then after neck, chest. What all you can examine in a chest? First of all, the chest are symmetrical, and the shape of the chest. In infants, the shape of the chest will be cylindrical and symmetrical, whereas in adults it will be elliptical and symmetrical, right? So you should see the shape. And breast nodules, which is the normal size is 5 mm, you can examine this breast nodules. And another thing is in chest is auscultation, maybe for finding heart murmurs or any wheezing, respiration discomforts. For that we should do auscultation on the chest part. Next, coming for abdomen. In abdomen, what all you will examine? First thing is whether abdomen is distended or normal, and another thing is umbilicus, for seeing the hygiene of the umbilicus, because umbilicus may have infections like water discharge or pus discharge, that we should go for. And another thing is umbilical hernia. To identify this, we should go examination of umbilicus. And another thing is by palpating the abdomen, you can see any organomegaly you can identify. After abdomen, next part is groin. What all examination you will do in groin? First of all, remove the diaper and examine the diaper area. First of all, what you can find here, initial thing is femoral pulse. Both side femoral pulse should be symmetrical. You should diagnose that. And next thing is genital parts. In male genital parts, you can go through the hydrocele if it is present, and the opening of the penis. And in female genitals, you can see that whether labia majora is covered the labia minora. In female genitals, labia majora should cover the labia minora. You can diagnose this. And the opening of the vagina or urinary tract. And in both the sex, you should find out the anal opening, whether the anal opening is clear or not, because in some congenital disorders the anal opening and urinary opening will be in same passage, so that they will be having discomfort in passing urine or in passing meconium, that is stool. So you should identify this. And after this groin part, what you will examine? You will examine the extremities. In extremities, what all we should find? 10 fingers first of all, right? 10 fingers. because some babies or some persons will be having extra finger growth in a upper extremity, that we will be known as polydactyl, right? Polydactyl type B, extra finger in a upper extremities. This we should identify. Then the movements of the extremities we can find out in the normalcy of a baby, and the shortening of the fingers, it is known as barachnoidactyl, the shortness of the fingers of the extremities, or the longer extremities, fingers of the extremities longer, it is known as arachnodactyl. These we can find out in a extremities. Then after extremities we will go through the examination of back. What all you can see in the back? First of all, the skin rashes, bluish blue gray macules, the skin rashes will be, if the newborn baby have this blue rashes, it will subside by itself, no need to worry. And another thing is erythema toxicum. These are the pinkish or reddish rashes on a back of a baby. It will appear after 24 hours to 48 hours of birth, but gradually within a week they will disappear, no need to treat any medicines, give any medicines. Another thing is sacral dimple. This is present in the near the hip joint and back of a baby. If it is absent, then there will be some sort of spinal disorders in a babies. So you should find out the sacral dimple in a back of a baby. These all are the full head to toe examination of a baby. What we left here? One thing we left here is fractures. Common fractures, bone fractures of newborn is, one thing is clavicle bone during the process of a labor, and another thing is hip dystocia in a process of cesarean. And these are the common fractures we can find in a newborn. So you should go through these both fractures. After head to toe examination, one initial step of reflexes we can see in a newborn, that is primitive reflexes. Which are primitive reflexes we can see in a newborn? These are, first thing, sucking reflex, as we see when we examine a mouth. Another thing is Moro's reflex, when we lift a baby little from the floor to 2 centimeters and we leave, the baby will abduct the extremities and adduct the extremities, or adduct the extremities, then suddenly they will abduct the extremities. This process is known as Moro's reflex. We can find here Moro's reflex. And another thing is rooting reflex. What is rooting reflex? When we touch the chin or cheek of a baby, when we touch the cheek of a baby, the baby will move suddenly, give response towards the stimulus, right? This is nothing but rooting reflex. And another thing is palmar grasp reflex. When we give a finger in a palm of a baby, what baby will do? Suddenly it will hold it tight, right? That is nothing but palmar grasp reflex. These are the primitive reflexes we can see in a newborn when we examine. So these are the steps which we can see in the examination of a newborn, normal basic physical examination of a newborn from head to toe. So hope this video will be helpful for all the consultants or all the especially pediatricians in the way of examination of a newborn, especially healthy newborn. Thank you.